A very good morning. Welcome back to the program. My name is Samuel Njoroge. The only way to start your day is on its final stretch this Tuesday morning. And as we did promise you earlier, we would like to close the show with having a conversation around cholera. It's a situation that has caused quite a scare, and we'd like to understand a few things, basic information, they're not so technical about it when it comes to how you can avoid getting cholera, the do's, the don'ts, the symptoms, what you should pay attention to, what you should not ignore, as well as address your questions that you'll be sending to us through the hashtag GMKKBC and also 22162. That's the SMS line. Begin with the initials GMK. I've got Dr. John Kiiru from the Kenya Medical Research Institute. He is a senior researcher with KEMRI. Welcome to the program, sir.
Thank you.
How are you doing this morning?
Very fine.
The situation is right here with us, but maybe we can start by appreciating a bit of a background on this particular disease in the country.
Definitely. Yeah, so I think we already know what cholera is. Cholera is a diarrheal disease, is an infectious disease, meaning that you can transmit it from one person to the other. The principal mode of transmission is fecal-oral route, meaning that it's by ingestion. There are many ways that you can catch this disease, but the principal way the disease spreads is through contaminated water. Food is just one of the things, but contaminated water is the most important. And one of the characteristics of cholera is the diarrhea. The diarrhea is like none other, because the cholera diarrhea is very voluminous, meaning that you actually secrete a lot of water.
Yes.
And that is the problem of cholera, because when you secrete a lot of water, then you dehydrate. And the diarrhea associated with cholera, especially in the advanced stages, is effortless. So you diarrhea without no effort, without effort, and you actually vomit without effort. And the diarrhea itself has a characteristic color, depending on how far it has progressed. It can look whitish, and this whitish color is what we call the rice diarrhea. And the reason why it's whitish is because the lining of your gastrointestinal tract has actually peeled off. Yes.
Okay. So that being the background, let's appreciate statistics so far. Where are we as a country? How many cases so far reported? How many dead?
So before I come to that, let me mention that cholera is a big problem in Africa. Africa actually contributes slightly over a half of all the cholera cases in the world. But actually, cholera is very new to Africa. The cholera only came to Africa in 1971. But as you know, in fact, cholera is the disease that led to the discovery of a new field of science called epidemiology in London, meaning that cholera has been there for a long time before it came to Africa. And once it came to Africa in 1971, we have had waves, and cholera, the germs that are causing cholera are evolving, and we have seen a lot of changes in terms of the way the disease progresses. And part of that has to do with global warming.
Yes.
But let's now come to this particular outbreak, or this particular wave. In fact, many people don't know that the current outbreaks that we're having actually started in 2014. This outbreak started in Tana River, and I think that was in 2014. Then it went to Garissa. After Garissa, it affected 9 districts. And what we're actually seeing today, these are peaks. But the outbreak has been ongoing. And in Nairobi, we have had 2 major peaks. First one was in the first hotel. Then the other one was at KICC. And I think 2015 from 2014 was the biggest peak, because in Kenya we had the highest number of cases, and I think if I can consult, in 2014, for example, we had 17,397 cases.
Reported.
Yes.
Yes.
Out of that, that is 10,500 568 was in 2015. 2016 was around 6,500. So you see this has been going. And then in 2015, this was the major. Globally, we had more than 173,000 cases. And Yemen itself, because Yemen, after the challenges that Yemen has been going through, it has become almost cholera endemic, meaning that cholera is almost there to stay. In that year alone, they had 250,000 cases. So in the 2 peaks in Nairobi, the first peak that was in the hotel, it affected 146 people. And then the second one at KICC affected 136 people. Yeah. But there's a good thing about this in terms of positive. Despite all these challenges, the death rate that we are seeing from cholera, these particular outbreaks, are not unusual. Because we have had the death up to 3%. I think up to now we have 1.2%, meaning that I think the way people responded, especially in the first instance, was commendable because they treated people based on symptoms even before we in KEMRI had actually started isolating the bacteria. So that response was very good.
What exactly causes this whole peak off-peak situation?
Yes.
Wes?
Cholera is actually the biggest indicator of social failure in terms of something is not going on well. And I can give you examples. After the Rwanda genocide, we had a cholera outbreak, a major one. After the challenges in Zaire, DRC, we had a major outbreak. The current problem in Yemen is related to instability. When Somalia became unstable, then we had outbreaks. Now, you can always attribute cholera to something. In the Kenyan situation, there are so many reasons that could be causing this outbreak, but the major, and I think many of us already know that, is the water shortage. And that is the reason why Nairobi is the most affected, because of population density. The water shortage has a bigger stress here than even in the villages where people can still access wells and so on. So when you have high density and then people don't have access to clean water and the water is very little, people start getting this water from other places.
Yes.
And let us always remember, even when there is no cholera, the germs are still there in the environment. Therefore, when people start getting water from untreated sources, the cases of outbreak come, and that is where you see the peaks. Yes.
It's activated, then we start seeing the peaks,
yes,
the off peaks. So what are we saying, that it will take a solution that is water related for this to go away?
Yeah, there are many suggestions that have been given how to end this outbreak. First of all is the response, and the response, I think we can also have to learn to love ourselves. I think the response is not very bad. The county government has responded, the national government has responded. When an outbreak happens, sometimes the response might be uncoordinated in the first days, but then things get into place. So I think the response is being refined every day. Task force has been formed. KEMRI is also on the forefront in terms of understanding the current pathogen, which we might be able to talk about later.
Yes.
But all said and done, if you remove the water in equation, the shortage of water, then you realize that cholera will go. Because I don't believe today we have poor sanitation than 2013. The problem that has come in is the water shortage. And how is this coming about? We have always known whenever we have El Nino, we have La Nina. In the biggest cholera outbreak in Kenya was between 1997 and 1999. Yeah. And that is when we had El Nino. And today we had El Nino just, I think, is it last year but one?
Last year.
Actually, right now we are experiencing some kind of La Nina. La Nina is when you have a lot of heat and sunshine and so on. And that evaporates a lot of water, brings the water shortage. So if you remove the equation of water shortage, then the outbreak goes. The sporadic cases might remain, but the cholera goes in terms of outbreaks. Yeah. So what I'm saying, as much as we are responding, let's agree that unless we solve the water problem, the shortage, the peaks we are even likely to see another peak. Because if this is July, and we expect the rains towards the end of October, there is a likelihood that we are not going to solve the water problem very soon.
Very soon.
Unless the rains comes early. Yeah.
What are the symptoms of cholera?
Yes, I think I had already mentioned that, and the first one is in the first stages you can get stomach cramps because your body is reacting and the stomach is the wall of the intestines are peeling off. Then you start having very watery diarrhea, and as I've already mentioned, the diarrhea looks like rice water, and then vomiting. But not everybody vomits. Not everybody has stomach clamps.
Yes.
Meaning that the biggest symptom for cholera is actually the voluminous. In many cases, many people don't have a fever, unlike other diarrhea. So that could be the biggest symptom. So whenever there is a cholera outbreak, it's very important to keep watch on family members, especially young children, when they have diarrhea that looks unusual.
Yes.
And during cholera outbreaks, it's very important to seek treatment very fast, because you can actually die within 4 hours after onset of diarrhea. In fact, it has been shown that within 6 hours, you can lose up to 30 liters of water. 30 liters of water is like 1 jerrycan.
That's huge.
So actually, you can shift from 90 kgs to 60 kgs in just 4 hours.
Yes.
When you lose so much water, then what happens? The blood becomes very thick. It's not able. You can't actually pump it because it's very thick. And once you cannot pump it. It can't go to the brain. It can't go to the kidney. You have organ failure, and within no time you get to a coma and die. So in fact, the biggest challenge of cholera is dehydration. And all what you need to do is to rehydrate. How do you rehydrate? First of all, in the beginning, in the very early stages, if you realize that you think that somebody has diarrhea, is to rehydrate them. Give them a lot of fluids. But then you can also go to a chemist, buy the ORS, oral rehydration salt, and that sachet, you mix it in 1 liter of water. If you don't have that, you can actually do your own remedy. And that is, you mix half a teaspoon of salt, 6 teaspoonfuls of sugar. Six
teaspoons of sugar. Half a teaspoon of salt.
Yes. Into 1 liter
of water.
Gulp.
Yes.
But somebody who has diarrhea for an hour might need to take up to 6 liters of this. When you do that, actually, the moment you start seeing these signs, you start administering these solutions, even as you're going to the hospital. And that is one challenge that we have seen. We have seen people who suspect that they have the cholera, and they are far away from, let's say, they're in Murang'a, they're in Machakos, they're in Nakuru, and people want to bring them to KNH, for example. And they just put them in an ambulance. The most important thing, even as you put them in an ambulance, put them on drip, so that along the way they're rehydrating. If you don't rehydrate them, you'll get to Nairobi, but the patient will be dead.
Will be dead.
Yeah.
Or at least then pack some water. Pack the solutions.
The problem, let me mention this. You can only give them water drinking in the very beginning. The
very initial stages.
Yeah, because if it goes beyond a certain point, then the walls have collapsed. The water cannot be absorbed. That is the reason why the ORS is very important, and the salt, it will stop. It will reverse the diarrhea. Actually, what the toxin of the bacteria does, once it gets to the cell, it reverses what we call in science osmosis. Meaning that instead of water coming into the cells, it actually gets out. Now, when you get the salt, it reverses, and now the water starts getting in. So when you do that, then the walls are not destroyed. The patient can absorb water through the GIT. But if it has gone beyond a certain point, then even if you give them oral water orally, it won't help them. So the drip is very important.
Very important. And then again, it's not plain water, it's a solution which you prepare using half a teaspoon of salt, 6 teaspoons of sugar, then you mix all that in 1 liter of water.
Yes.
and that is going to do. But that is not a replacement to going to a medical facility
Absolutely.
and seeking proper medical attention.
Yeah.
Let's talk about the do's and the don'ts. In such a time like this, people are scared, eating in Nairobi, taking water.
Yeah.
Literally, our social life has been a little disturbed.
Absolutely.
What are the do's and don'ts during such a period, Dr. Ari?
Yes, and let me first of all go back to the ORS. There's something that you should be very careful about.
Okay.
The water. You can have your ORS that you've prepared, but the most important thing, what water are you using?
The quality of the water.
Absolutely. Because you can have the ORS, but actually you are adding contaminated water. And that is where you got the diarrhea from.
In the first place.
So the very important thing is to look at the water. Now let's go to the do's. During a cholera outbreak, one of the most important things to do is to ensure that your water is very clean. And I think I've said this in many forums, that outside the outbreaks, when there are no outbreaks, people advise that you boil your drinking water, you get potable water. That's okay. But during an outbreak, that can be a big challenge, because the water you're drinking can be boiled, but you have washed that glass with water that is contaminated. So it means that if you are to boil, you are talking about boiling the whole water, all water in the house.
Cleaning water,
It's not possible.
everything.
So in that case,
Yes.
that is when chlorination comes in very well. And what we advise is you shift to chlorination. You use Tabs, you use Aquaguard, and there are quite a number of commercial, and they are very easy to use. And it's very important to see this. When during an outbreak, do not only contaminate your drinking water, decontaminate even the water that you are using for washing, for cleaning, because this is the same water that you're going to use to clean your utensils. Even if you are drinking clean water and the utensils are contaminated, you have a problem. So that's the first thing, the water. The second thing, the food. It's preferable to avoid large gatherings, especially when you go there. Then be very careful to eat. I'm not telling people not to eat, but be careful. Be vigilant.
Yes.
And especially avoid raw foods like salads, like fruits that you don't peel, okay? Because contamination. And then funerals, preferably do not eat. And let me say this. One of the biggest challenges with big gatherings, there are two problems. Big gathering, if you have ever had a wedding, you know there is a lot of stress in terms of catering. So what people do, they outsource. And when you outsource, the wedding, let's say, or the funeral is on Saturday, and you're expecting 500 people. So you either outsource who will bring the food or who will prepare it. So you can get very nice green veggies, but they're coming from the sewage water. They have been grown in sewage water.
Sewage water.
You know? So
yes.
You have to be very careful in anything that you don't cook. And then when you cook, this has to be hot, preferably. So water, food, then in terms of, you have to be vigilant to see the symptoms.
Right.
Yeah.
Let's also take a look at the question of vaccines. We have a vaccine.
Yes.
Isn't that then a solution good enough? And how do we go about administering a vaccine? Can I go for a vaccine? Yeah.
So the vaccine is, actually we do have 3 vaccines that have been approved. And I've also mentioned this somewhere else. It's very important. These vaccines are not the same, and they don't cost the same. So first of all, the vaccine is not free. You buy it because it's still commercial. It's not been included in the vaccine kit by the government. And some vaccine will be active for 6 months, others 2 years, others 5 years. But the most important thing is to ask your doctor, which vaccine am I taking, for how long will it be active? That is the first thing. Second thing is, vaccines may not work immediately. So you have to ask your doctor, and so he has to tell you, once I give you this vaccine, protection will come maybe after 1 or 2, 3 days. But remember, the very fact that you've been vaccinated does not mean you lose guard in terms of hygiene and sanitation. You still maintain it. And the other thing is that the vaccine is very good, because if you know that a household has been exposed to cholera, or a certain region is an epidemic area or endemic area, and those people are at risk. If you have, let's say, 50 people, and you vaccinate 25, the other 25 often are protected. And we call this herd immunity, whereby you vaccinate a few people to curtail or to stop the spread. Because for if I'm sick and there's somebody between us, for you to get sick, then it has to be a chain. When you break that chain, you slow down the outbreak. So in fact, even maybe possibly in future we can impress the government to do this, that during an outbreak, we can look at the risky population, and possibly the government can be coming in to vaccinate the most risky population, and that can actually slow down the outbreak.
When you talk about cost of the vaccine,
Yes.
One, is it too costly for the public to access? Number two, is it dependent on how long the vaccine will last?
Okay. So I think I'm not, let me be clear. I think I only have an idea of how much the vaccine. In fact, I'm not vaccinated.
Yourself.
Yeah, but I think from what I've seen, I think the cost is between 2,500 and 6,000. Some vaccines require 1 dose, others 2 doses, and so on. Some vaccines, the doses are separated.
Yeah.
So when you're talking about 2,500, it's not very little money. Knowing that most of the people in Nairobi live below $1 a day.
And
So
times are hard.
and times are hard.
Yeah.
So it's not very, very expensive, but you can imagine if you lost your relative, it's even more expensive. Possibly, maybe the government can start working with WHO, UNICEF maybe, to try, maybe these people can even subside, especially when we have an epicenter where the problem is, maybe for the most vulnerable, the young children, and so on.
Most vulnerable for the young
Yeah.
children, which then brings me to the other point, Daktari. When we are having mitigation efforts for the adults, are they similar to teenagers and children alike, or
Yeah.
are there special considerations for those for the various age brackets?
Yeah. So the first, I think, if I can rephrase that,
Yes.
what are the most risky population? So the most risky population are people who come in contact, one, with sewage, contaminated water, and anybody who is not accessing properly treated water. So that cuts across. But the funny thing, and as many people have never noted this, during an outbreak, you rarely get infants getting this cholera. And in fact, the WHO actually recommends during an active cholera outbreak, if you have a child, it's very important to breastfeed them. Breastfeeding has been shown, especially if you do it in a hygienic way.
Yes.
And this is, I think I would tell the mothers this. During an outbreak, there are two things that I normally advise. One, always carry a hand sanitizer. And KEMRI has a very good hand sanitizer.
Yes.
Let me promote my employer. So we have a very good hand sanitizer, and this actually does very well. Now, when you have a hand sanitizer, it's because you don't know the water that you want to wash your hands with, especially before you breastfeed, because you can actually have contaminated water, and when you're breastfeeding, you pass that to the child.
Yes.
The second thing that I often advise during outbreak is when you get home, don't go into the house in your shoes. Remove them outside the door, wipe them and clean them in soap and water, because during an outbreak, an area can be contaminated. And when you're walking, you're actually picking the bugs. And if you have a carpet, it will go in the carpet, and then your child, especially if you have an infant who is crawling in the house, they have a very high chance. Yeah,
yes.
But so the risky populations are those. The other risky population are the people handling cholera, okay? Especially people who are sick. And that is why it's important. And I'm very impressed. I think the collaboration between the government and the county government and the national, they have started setting up cholera treatment center. This is very important because during an outbreak, it's very important to separate people who are sick and people who are not sick, especially the relatives, because some people may not know how to handle the patient. So if you don't separate the two, the chances of cases arising from contact, the relatives, is very high. So when you have a cholera treatment center, people go there, they remain there, and the people taking care of them are professionals. So it's very important to know when somebody has cholera, take them to a health center, so that instead of staying with them in the house, because there will be a lot of contamination and soiling, and that can actually make another person to get these germs.
These germs, you mentioned that people handling patients
Yes.
with cholera are part of the risk populations.
Yes.
Then how do you handle the whole question of isolation in a right way?
Yes.
In the right manner?
Absolutely.
Yeah.
So if, let's say, you have a patient, it's at night or during the day, the patient is fall sick, and okay, before I go there, the most important thing during a cholera outbreak is for people to know the symptoms to look for, because that will help you know before this person diarrheas a lot and contaminates the environment. So the earlier you realize that, the more chances that you'll take them to the hospital, to the clinic early enough. So if by any chance the person starts diarrheaing in the house, it's very important to decontaminate. And decontamination, you can just use simple jik, spirit if you don't, if you have some. So always clean your hand in between, no eating, no drinking, no smoking during handling of the patient and transporting them. And then anything that he has soiled in the house, soiling meaning contamination, then you clean it, possibly remove it, soak it in jik, soak it in disinfectant, then you are good to go. Then on the way, if for example you have taken a taxi, it's very important maybe you look, because this person is actually diarrheaing. And I don't know how many people have ever gone to a cholera treatment center. The beds are very unique because it's a bed, and at the center of it there is a hole, and the bucket is put below that hole. The reason is, when the patient comes, he cannot tell you, let me go to the toilet. He's diarrheaing effortlessly. And that will be happening even when you're transporting them.
There is no signal.
Absolutely.
Yes.
And so what you need to do is, especially if the car is not leather seat, put a polythene, so that then you don't contaminate the car. And after that, wash the car properly. And before you wash, decontaminate it, because you could go to a car wash. This car wash is right on the river, and you're actually washing the germs in. So you can
Into
see
the river.
it's a whole complex thing of the way the germs spread. And they can spread in a very funny way that you may not connect. Like, you have a patient, you've taken them to hospital, you've taken the car to a car wash or something like that, and you cannot connect. Yeah.
I'm worried. Once we've consumed the kind of information we're consuming this morning.
Yes.
Because then the question begs around the food and eating concern.
Yeah.
Right now, the key advice is avoid eating in Nairobi.
Yes.
If possible, pack your own food.
Yes.
You've just told us, avoid eating in gatherings or food prepared in mass. And that is exactly what hotels do. They prepare food in mass. Where does that leave me, Daktari?
Yeah. So, in fact, my aim is not to scare people, but to give them information.
Yes.
And let me tell you something. Before an outbreak, especially during the peak, before the peak, people are very naive. When the peak starts, people get a lot of information. In our KEMRI website, we have posted information on cholera, and a lot of people are accessing it. And I've even gone to people I never thought they access this information, and they are educating themselves. So the beautiful thing about during an outbreak is people try to look for information. So meaning that in the beginning, it's very possible to get these infections moving around. But as people get advised and they know the do's and don'ts, the infections become low. Therefore, in fact, let me mention this. Despite all these challenges, from 2014, we don't have a travel restriction to Kenya, or to any other country, because cholera is manageable. So we don't need to scare people. But what we all need people to do is to be on alert. People to be sure of the food they are taking, and take it in the proper manner. The issue of also of certification of food handlers is important. So those are some of the things to look at. But I would not like people to be scared. We still have a life. And I think, as you can see, Nairobi is almost 3 million people. When you look at the number of cases that have happened, it's less than 300, meaning that we can still handle this. Yeah.
We can still handle
We can
this.
still handle it.
That is a breath of good fresh air this morning, right? That we can still handle this. You know, it's not a scare because it started in 2014.
Yes.
We've been surviving. We are at a peak season. So all it means is that we've got to be extra vigilant and make informed health choices and decisions when it comes to what we put into our body. So you can still go to your favorite restaurant and order your favorite meal.
Yeah.
Just make sure that you're safe while you're taking it, which then is the dilemma. How do I make sure I'm safe, Daktari?
Yeah, so the cholera stoppage starts with you. And you is me and the person handling the food,
Yes.
the government, the county government, the national government, health workers, everybody. So, and that is a challenge. During an outbreak, people look unto the government to stop this. But maybe you know where you're getting the water. Why don't you just treat it?
Yeah.
It looks so casual, but that 5 mLs of Aquaguard or Adatab can help you.
Yeah, thinking government solutions is very macro. It's very
Absolutely,
top
it's at the
there.
end because you see, as I said, we can play politics, we can talk so much, but the problem of Korea today is about shortage of water.
Yes.
And the shortage of water, from my own estimation, it will not go until end of October. So if you wait for the government to come and finish this, it's not always easy. It's not always easy. But the government also has a role to play in terms of ensuring that mitigations happen. If people are selling water, have those people been licensed? Where is the water coming from? Is the water treated? Because you can imagine, one tanker can supply so many families and the problem will never go. So nobody is absorbed from this blame, from you, me, and everyone.
The devil is in the details, so
Yeah.
let's begin there.
Yeah.
The detail before we talk about anything else. The public health response so far. In the course of this interview, you've described it as beautiful, impressive, and the way to go. Can we enhance it a bit? What is lacking to make it wholesome?
The problem, and this is a problem, is a Kenyan problem.
Yes.
We normally react. And once the outbreak is gone, we forget. We have a cholera outbreak task force. I believe this outbreak task force will continue even beyond. Remember, 2014 up to now, those are 3 years. It's only that the outbreaks disappear, then peak, meaning that maybe we never know. It will continue going. And let me mention this. The real problem of cholera started in 2005. Before then, we used to have cholera separated in 3-4 years. But from 2015, there are some times where cholera has hit Kenya in a time span of 4 months. So cholera is coming to be something to live with us, and that is partially global warming, changes in environment, population density, people movement, and so on. And there's something else we forgot to mention, the problem of refugees. Yeah. In fact, this outbreak or major outbreaks have normally been traced in refugee camps. Dadaab, Kakuma, and those are people who are congested. Their access to sanitation and basic amenities is really stretched. So that is a challenge. So UNICEF, IOM should also help in terms of, because once you deal with a risky population, then you help the larger population.
Now that we're mentioning population, let's get back to the issue of population density. And we did mention that one of the key reasons why Nairobi had an alarm was because of the population density. Is it the same explanation that can be given to Garissa? Because Garissa too was a concern, is still a concern area.
So, okay, I'm a molecular biologist. But I'm not an epidemiologist. But let me just use my layman's knowledge, which I've gathered from reading here and there. I think one of the challenges with Kakuma, Lodwar, and Wajir is the water table is very low, very high. Okay, there's a challenge of water table,
Yes.
and that is the reason why some of the places even waste management becomes a challenge. And when you have water shortage, complicated by shallow wells, then it becomes a problem. Unless those people get piped water, treated from a central point, distributed, the problem will continue. The other challenge, when the places I've mentioned, Kakuma, Garissa, and whatever, Wajir, these are places very close to refugee areas. And we are not blaming refugees. We know the situation they live in. And the Nairobi problem, for example, you should ask me, why Nairobi and not Kiambu?
Yeah,
It's a matter of so many people sharing a limited resource that is water. Yeah.
So actually, now that you raised the question of why Nairobi and not Kiambu, I was just trying to look at how figures have been tabulated over time. And just very recently, in May, recorded 88 cases in Garissa, 15 in Vihiga, and 2 deaths therein. Then there were 2 cases reported in Mombasa, 1 in Kiambu, 11 in Muranga. You know, it's a situation of here, there, it's all over the place. Why is that?
Well, these are the challenges of globalization. Remember, we have globalization internationally and also locally. So today, with the SGR, I am 4 hours, Mombasa. Possibly when SGR brings in a return train, I'll be going, swim and come back. So if there is an outbreak, if there is an outbreak in Mombasa, I'll have it here. So movement. And that is also the challenge with refugee situation, because refugees can also be quite mobile. The challenge in Syria, the challenge in Iraq has all to do with people movement. And in this era, you cannot stop people from moving. You can't.
You cannot stop people from moving. Risk assessment.
Risk assessment, I think, one, we should be vigilant. Let's not only look at cholera from the human part of there is environmental sanitation. And let me mention this, it's only that we can't really go very deep into science,
details,
but let me ask you, where is the germs when there is no outbreak? A lot of people don't ask themselves that way, that question. The germs are actually in the soil, in the water. The ocean water, a lot of people don't know. The cholera germs is a salt-loving germ. It likes the salt. So if I go to the Indian Ocean and scoop the water, come to my KEMRI lab and treat that water in a certain way, which we call enrichment, I'm almost sure I'll get the germs. So it is always there, yet there is no outbreak. So there's something that makes the switch. So when there is no outbreak, the pathogen or the germ is still spreading in nature. So we need environmental sanitation. That is why we need to handle our sewage properly. The reason why we have problem of cholera during a rainy season is the overflow. So sewage, we handle the garbage, we handle the water problem, and then we also educate people. People need to be vigilant, because one of the most important things to do when you want to handle cholera is people to identify the principal cases, the very first case. If it's properly identified in the first instance, it is contained very easily
handled. We got literally like a minute to wind up this show, but I'd like to give you an opportunity, Daktari, for you to go back to the issue of the do's and the don'ts, where we discussed gatherings and salads and treatment of fruits. Let's sensitize Kenyans on that very point, the do's and the don'ts in addressing this particular outbreak and what they can be able to do at home as we bring this to a close.
Okay, so I'll go over it again. The first thing, make sure that the water you are using is clean, and if you don't know where it came from, let's say you've bought it from a vendor, chlorinate it. During a cholera outbreak, chlorinate including your tap water. The reason is The pipe could be passing somewhere. Somebody has tried to disconnect and connect his own pipe, and the germs have got it. So don't trust the water until the outbreak is gone. So yes, eat properly cooked food, preferably hot, properly prepared.
Right.
If it's in a hotel, go to a hotel or a joint that you know that the standards are okay. It's not always easy to know that. Thirdly, be on the lookout for the signs. Handle the patients in a nice way. Decontaminate in case of any soiling, contamination with fecal and vomit. And then
avoid raw food.
And then if you can, get a vaccination. Okay. Then always be sure that whenever you see the very first symptoms, the first thing to rush to is the ORS, the oral rehydration salts that you can get to the chemist, or the formulation that we talked about.
The formulation that we talked about, which, by the way, it's half a teaspoon of salt, 6 teaspoons of sugar. Please dilute that in 1 liter of clean water, and then administer that to the patient as you find your way to the nearest medical facility